Mental health and mental illnesses is one of the biggest yet least talked about issues known to date. To define mental illness, I'm going to use Crash Course's definition in their psychological videos. So they use the definition: a deviant, distressful, and dysfunctional pattern of thoughts, feelings, or behaviors that interferes with the ability to function in a healthy way. The reason why mental health is such a big issue today is because 1 in 4 Americans are affected with a mental illness, yet no one talks about it. It's almost like it's a taboo to talk about in public and in any form of debate. The DSM, also known as the Diagnostic and Statistical Manual of Mental Disorders, lists every known mental disorder known to date, even the common ones such as like schizophrenia and bipolar disorder, to the lesser known ones such as the Alice in Wonderland syndrome and the alien hand syndrome, which most people have never heard of before. Due to how little mental illness is actually talked about in everyday society, sometimes when we say things such as this person is OCD, we don't mean it in the actual way of the mental illness such as OCD. So let's say someone is extremely clean or really nitpicky about something, and we say that they're OCD, but in actuality OCD is not always just about being clean or needing symmetry. In actuality, the definition of OCD according to medlineplus.gov is a mental disorder in which people have unwanted and repeated thoughts, feelings, ideas, sensations, and behaviors that drive them to do something over and over. Often that person carries out the behaviors to get rid of obsessive thoughts. While the way that we stereotype mental illnesses such as OCD in everyday language, that's not nearly as offensive to these people as it is for the treatment costs. The costs for them is rising while the benefits are lowering for certain patients because of the way that insurance is billing them and how they need to go about paying for these things. In a recent interview with Dr. Jessica Estes, she explains how the billing is between a private and a public primary care provider.
Just to give you an example, if there was a primary care provider and they were going to see a patient for a 30-minute visit, and I saw a patient for the same 30-minute visit, and I billed the exact same code with the exact same charge, the primary care provider makes more money per visit than I do.
The way that funding works for these public versus private institutions make it harder for funding to help research how mental illness works and how we can stop it. If we divide up the way we are researching and the money that we can put behind the funding for researching, it hurts rather than helps how we can research and hopefully either get rid of or help people cope with mental illnesses in helping today's society. One big issue with mental illness is how often the people that are mentally ill will self-medicate, which is when someone will take a drug, abuse it, things such as alcohol, prescription medication. And the reason why this is so dangerous is because the likelihood of someone either being arrested or them overdosing and possibly dying because of taking this drug, which is not healthy for them. Due to someone self-medicating, this will cause them to become addicted to a drug, and because of this, patients will often have to go to rehab, and Dr. Estes explains how rehab works.
You know, we sometimes see things like Seroquel, gabapentin, Neurontin. The newest street drug is something called Kratom. So that's a new one, look it up. At lower doses it acts one way, like an opiate. At higher doses it acts like a psychostimulant, like an ADHD medicine. And so what we've learned over time is as we crack down on one thing, 5 others pop up in its place.
It's not easy being able to get rid of one drug. In fact, it's extremely hard. This is hard because, like Dr. Estes said, once they get rid of one drug, another will pop up. It is believed that one way to help people cope with mental illness and to potentially get rid of a mental illness is through understanding. If we can understand how a mental illness works, we can understand how to better medicate a person and potentially stop that person from becoming mentally ill.